my name is Jasmine Lamb, and I will be discussing the vaginal microbiome and contraceptives. So what is the vaginal microbiome? The vaginal microbiome is critical to the sexual and reproductive health of women. The vaginal flora is highly individualized, varying per woman. This microbiome is a dynamic environment that constantly fluctuates throughout a woman's menstrual cycle. It is dependent on age, menstrual cycle stage, hormonal status, genetic background, sexual activity, and more. The lactobacillus species is a gram-positive bacteria that resides in and dominates vaginal microbial communities. The normal vaginal flora should consist of low alpha diversity, which is a small amount of bacterial diversity, with the dominance of lactobacillus to maintain stability. It serves to protect the microbiome from infections while maintaining the health of the vaginal epithelium, which creates an ideal normal low pH environment in the vagina that prevents pathogenic growth. Lactobacillus is quite literally the elite employee of the vaginal microbiome. I hope you guys know what contraceptives are. But if you didn't, there are many forms, ranging from mechanical forms like condoms and spermicides, which we will not be focusing on today, to prescribed IUDs, oral medication, implants, and whatnot. IUDs and oral medications can be hormonal or non-hormonal. Of course, the main role of contraceptives is to prevent pregnancy, but physicians can also prescribe contraceptives to regulate menstrual cycles, acne, or manage reproductive issues. The National Center for Biotechnology Information conducted a 2-year study following 23 women aged 18 to 22 and categorized them into 3 groups of 1, our control group with no contraceptive use, 2, combined estrogen and progestin systemic release contraceptives, all of which have a hormone-free week, and 3, progestin-only local release contraceptives, which have no hormone-free week. These women submitted daily vaginal swabs along with a record of their menstrual status, diet, sexual activity, and contraceptive status at time of collection. The study showed that women using combined oral contraceptives and those not on any contraceptives had high average lactobacillus abundances with similar periodic fluctuations of vaginal microbiota associated with the stages of menstrual cycle. However, women on progestin-only contraceptives had a lower average lactobacillus abundance, as well as altered periodic fluctuations of vaginal microbiota. Based on the study, combined estrogen and progestin contraceptives help regulate the vaginal microbiome, mimicking the normal microbiome of a non-contraceptive user throughout the stages of menstrual cycles, while the local release of progestin disrupts and suppresses lactobacillus growth. This also solidified other studies that estrogen promotes lactobacillus growth in the vagina, which is shown to be consistent through epidemiological observations through the course of a woman's life. For example, lactobacillus abundance increases during puberty when levels of estrogen also increase. In postmenopause, lactobacillus levels decline as estrogen declines, and with estrogen replacement therapy, lactobacillus levels are then restored. It is important to note that in comparison to estrogen studies on lactobacillus, there are very few on progestin. Ways to improve future research would be to study a larger group of women, as this experiment had a small number of female participants. Another point would be to shift our research focus to how progestin impacts the vaginal microbiome and lactobacillus growth, as we have already had a number of studies on the impact of estrogen. Furthermore, because the study was done on women aged 18 to 22, expanding the age groups would allow us to see how age may affect these results and if there are any other significant findings. Key takeaways. Ladies, it is important as a patient to be informed about your vaginal health and existing methods of contraceptives. Choose what is right for you. Don't be afraid to ask your provider questions regarding your health and your medication options. Remember that what may work for another may not work for you. Practice safe sex and understand how to properly use contraceptives, whether it is a physical barrier or medication. That goes for everyone. Note some oral contraceptives have a very strict time window in which you must take your medication or you are no longer protected. Lastly, understand your body. You know your body. Be your own advocate. And these are our references. Thank you. Thank you for listening.